has an issue with recording, please just drop it in chat or private chat me and we'll address it with you. Otherwise, this session is recorded simply for the purposes of sharing it out with everyone afterwards. One request that we have, because we haven't quite figured out some of the complications, is that we ask that you please not use any AI bots during this session. It completely interrupted our recording for the last one that we had, and we haven't quite figured out why. That said, we completely appreciate the role of assistive technology. So if that's something that you need in addition to the full recording and a transcript, then please contact us, because the last thing we want to do is not be accessible. We're just trying to make our way through this. So good afternoon or good morning for those of you that are on the West Coast and making it near lunchtime, or any of our Alaska people that might be on. I'm thrilled to welcome you. Happy spring, and to what I think is actually the first in our Rural Learning Series of 2025. I'm Kim Finney, co-founder of Rural Youth Catalyst. My colleague is Kathleen Moxon. We are just thrilled to have you here. Please keep an eye out for the topics throughout the remainder of the year that we will have. Kind of just some basic introductions if you're new to us. We call these formal, informal webinars. We choose at the last minute to kindly make it so that we can see all your wonderful faces and make it a little bit easier for you to be able to ask questions, drop things into chat. So do feel free, if you're got a burning question or confusion or whatever, to just raise your hand, speak out, and Lauren or myself will try to make sure that we get to you so you don't sit for 50 minutes in confusion. As always, drop things into chat and we'll make sure to pull them forward, and we try to leave some time at the end for questions, discussion. There will be a follow-up session for those of you that would like to do a deeper dive and real interested in seeing how you might be able to go about either initiating this work within your own program or organization, or supporting it in your community, but are like, gee, I really liked what I heard and I'd like to go deeper. That's going to be on June 5th at 2 p.m. We will send out a follow-up just in terms of registration, but we think that when you registered for this one, you got notification of that one as well. And again, we will absolutely get this recording out to everyone. And so I don't forget, a huge thank you, shout out to Chloe Seaton, who is our magical Zoom and behind the scenes wizard. She makes these things possible. Okay. So without further ado, we are super thrilled to have Lauren Wilkie with us here. She is the Vice President of Strategic Partnerships with Point Source Youth. Lauren has deep experience working at the most local level in Boston and nationally across a variety of organizations, but all seeped in the issues of youth homelessness, including rural youth homelessness. So we were really excited when we got connected with Lauren and learned more about the direct cash transfer project, which we had been following as a concept for some time. And so we were really excited to have Lauren be like, no, I really want to talk about this in a rural context and how we can support rural organizations. So you've all seen the longer introduction. But I'll also say, for those of you, since this is a rural conversation and sometimes this matters, Lauren also had a background as a Tar Heel at one point, so you can trust her. That's all I'm gonna say. You can trust her. Okay. Thank you, Lauren, for being here, and thank you everyone for joining, and Lauren, take it away.
Beautiful. Thank you for that introduction, Kim. And let me get into sharing my slides. Oh, wait. See, I need like TA for slide sharing sometimes. Okay. Can everyone see my slides? Great. Okay, thank you. So yeah, thanks for that introduction, Kim. I'm really excited to talk about what cash for prevention can look like in a rural setting. And like Kim said, my organization, Point Source Youth, is a national organization working in the movement to end youth homelessness. And over the last few years of strategic planning and thinking to get closer to our mission of placing power and resources in the hands of young people, we decided to get really hyper focused on cash, seeing that as the most transformative, liberatory tactic for youth homelessness, and thinking about how can we um, give as much autonomy to young people to decide their housing pathways that resonate and are safe for them outside of all of the systems of our country that I don't always think respond in nimble or meaningful ways for young people experiencing homelessness. Um, like Kim said, I always like to give my a little bit of an asterisk to my current Boston living situation. Because I grew up in Eastern North Carolina in a community in Lenore County, Kinston, North Carolina. And so for many years, my family has lived in that county. And so when I think of myself, I think of those rural roots. And so I think of my own community where there was so much community care and mutual aid that was happening in the community and had been happening for generations. And so when I think of cash in a community, I think about like, what could my grandfather's neighbor have done if given this amount of money? Like she was taking in um, young people in our community that needed support without resources. Like what could have happened if those young people had resources? Um, and so it'd be helpful for me just to get a sense of who you all are. If you could put in the chat your name, your pronouns, the community organization that you're from and your role. And you know, I always love to hear like what folks think about with their own community, what makes it special, what's something that you're proud of. And you know, it's so random, but so the thing I love about Boston is my proximity to the ocean. I can be at the ocean in less than 20 minutes. But the thing I miss about Eastern North Carolina is boiled peanuts on the side of the road. I still get like a serious peanut craving every summer, and there are no boiled peanuts on the side of the road in Massachusetts. Um, so, just to set out some goals for today, sharing more about our model of cash for prevention, hearing more from all of you about how this model could work in your community, what are some of the challenges or opportunities you see, and really just open up for discussion and questions. Like Kim said, I'm coming back in a few weeks in June, so if there are ways to dig in deeper, would love to take notes of that too. So start to think about those wheels turning now. Um, so one of the things that PSY has tried to get better at over the last year or so is digging and leaning into narrative and storytelling. And we have this youth media advocacy project where we worked with a group of young people to tell their story about what it meant to both be consultants in designing the project in their local community, as well as recipients of the cash in their community. And so we have a video series. I think there's 7 or 8 videos up on our YouTube channel now, and I can put the link in the chat if folks want to check it out. But we have a bunch of stories. They're about 6 minutes each from one in Texas, Arizona, New York, and Atlanta. and it's from the young person's perspective about like what it meant to receive the cash. But this is the launch video, and I think it's really powerful, so I wanted to share it. Um,
If your mom's about to kick you
just
out
play
in
again.
less than 30 days and you need to figure something out quick, you're eligible. If you're in a relationship and they're beating you down and you need to get away, you're eligible. If you don't have the mental or physical capacity to access the care you need, like PrEP or HIV care, you're eligible. If you're couch surfing at your sister, mother, grandma, brother, uncle's house, you're eligible. Direct cash transfers as prevention is a housing stability program that instantly puts unconditional gift cash payments in the hands of a young person with optional supportive programming and other resources. Once discovering you're eligible, all you have to do is connect with the provider and design your housing stability plan. All it takes is really just to make living conditions a little bit more tenable. So there was a young person who says, I'm living with my uncle. This works for me, but unfortunately, I can't live here safely. So we poured money into fixing the basement and retrofitting it so that it worked. Sometimes it's not about saying, you know what, we'll just put you in a new apartment. It's about what the young person wants. And I think that's what's so beautiful and so unique about this program. It's not just about stabilizing, but it's about getting to that next step and really walking into the future because the future is now. See for yourself how direct cash transfer works. We've been talking to recipients across the country about the impact, and it's one thing to hear that it works, and it's another to truly experience it in their own words. Young people know exactly what they need. All they need is the resources and capacity to make their dreams come true. Stay tuned to see more of their stories.
So that gives you a sense of the launch of the video, and then each of them did their own video about how it felt to be in the program, what were the results of that. And we've been doing, if you subscribe to our mailing list, you will get, or follow us on socials, you'll get to see more of that content as it comes out.
If your mom's about to kick you out in less than 30 days,
Okay. So with PSY's model, I wanted to give a heads up in case you do go to our website or read our report after this, that we recently did a name change from direct cash transfers as prevention to the Targeted Housing Assistance Program. So one of the things we heard from partners is needing a distinction. Some of you may know about direct cash transfers as a model and a concept, which is 24 monthly payments to youth experiencing homelessness, which PSY also works on. And so we wanted a distinction between those two projects. And we think that the name of targeted housing assistance kind of calls in that this is a housing program. It is targeted to youth experiencing homelessness. And so if you do end up on our website later or hear about this program and you're like, wait, we were in this session where we were talking about direct cash transfers as prevention, just want you to know that it's all the same program and you're in the right place. So, to dig into our model, so our model is based on Washington's Homelessness Prevention and Diversion Fund. So, in 2020, a group of funders in Seattle were coming together and trying to figure out like what is the way that we can disrupt entries into homelessness in our city, and they came up with this one organization in Seattle, Africatown, was doing a centralized diversion fund, and they decided to say, could we replicate the model that Africatown is doing across the state? So for those of you who are familiar with Washington, it has a few urban centers and a lot of rural area. And so they were curious, is this something that is an urban model, or is this something that could be replicated across our state? And so they rolled out HPDF, which was the statewide model, where one-time cash payment with some supportive services. And they just published their fourth annual report. And so that 93% is for HPDF's fourth year. So they see that 93% of young people who accessed the fund were stably housed 1 year later. So it's really amazing when you consider the The average payment, which I'll have some data later, is between $2,000 and $4,000, and that you're getting stable housing for the next year out of that payment. And so we're seeing that it is true that a lot of young people's experience of homelessness can be disrupted with a minimal amount in comparison to all the other costs of services and systems that they interact with. Um, so in 2023, two of the funders from Washington came to PointSource and said, hey, now we're curious if we can replicate this model nationally. And so in 2024, we launched across 7 communities. Using this model that I'll share more details about in a couple slides, but it was Lane County, Oregon, Contra Costa County, California, Tucson, Arizona, Austin, Texas, Atlanta, Georgia, Grand Rapids, Michigan, and New York City. New York City had 2 grantee organizations, so it was 8 organizations across 7 communities. And I don't know if any of you saw, but we did for the first round do a request for proposals, an RFP. So we had a huge response, and so these were the 7 communities that ultimately were funded. So what the model is kind of based in is that it's based in a community model. So the way we orient the project in the community is that all youth in that community is a collective responsibility. So it's not just trying to disrupt some of the thinking around my organization serves the young people that come to my front door. My organization only serves my youth. But thinking about all youth in the community as our responsibility, and all of the cash resources that ultimately in that community are considered to be for any young person in that community, not just that lead community-based organization. The community-based organization has a really big role of being kind of the center of the wheel, but that they're expected to be abundant and thoughtful in their consideration of that resource. So when we were in the design process with our team of hired youth consultants, there were 3 issues identified by those young people and other system leaders that we were talking to that influenced the development of this model. So we were seeing and hearing that young people often interact with safe adults in other systems of care and other areas of their lives when they have a housing crisis, but that trusted adult might not be able to access the homelessness system or resources within the homelessness system. So you might, as a young person, when I was first experiencing housing instability, I was talking to my guidance counselor at school. My guidance counselor did not know what the next step was. And to be honest, my county did not have many resources to begin with. And so she was able to help me in a limited way, but I think about where like the organizations that we work with now, like if you get connected to them, there's like this whole thing that opens up. And so wanting those safe adults in that young person's life to come to be able to go, oh, when Kim comes to me, I actually know who to call because I've been trained by this lead community-based organization to access this resource. We also know that there are limited housing supports for young people who are not yet considered literally homeless. So I mean like in shelter, sleeping in their car, sleeping outside, that there are not a ton of resources for young people who are who are at risk of homelessness, who are starting to see that slide closer to homelessness, but are still able to couch surf or move around, that there aren't a ton of housing support services for them in their community. And also those smaller community-led organizations aren't always seen as homeless youth providers in a community and are oftentimes not accessing those traditional sources of funds. So they might not have a pathway to access a housing support that does exist in the community because they're not formally or informally connected to the organizations that do. So this is also trying to bridge that. So to give you kind of a visual of what I'm talking about, in Grand Rapids, Michigan, our partner, our lead community-based organization was Aya Youth Collective, or AYA, and they came when we funded them. They, with our support, stood up a community-based model where they identified and trained a group of their staff plus some from staff of external organizations. So those organizations would be trained as prevention specialists and trained to access the funds that AYA had been given. And so you can see the different examples. Some communities have many more circles, some communities have less, but you can see that it's different. You know, it's the local LGBT center, it can be your local school. Some folks had faith leaders in one of their circles. Just thinking about where are the places in your community that young people are already showing up, and how can we make sure that those folks are learning about this? So that's the way to create the community consciousness around this resource and around how we're serving the shift in serving young people. So to get a little deeper into the program model, so it's cash plus services. So for the cash payments, it's a one-time cash payment that they determine the amount based on a housing plan. So there's a housing action plan that's developed with a prevention specialist. So the two sit down together and say, you know, what's going on in your life that could stabilize your housing situation? What amount could stabilize your housing situation? What else is happening in your life? One of the other things our youth consultants flagged for us was our field is frequently oriented to more of a scarcity mindset where what is the kind of like lowest amount that we can offer folks? And with these creative housing conversations, we're trying to understand that and also understand like what does the next month or two look like not wanting to have the young person to both have what they need to resolve their immediate crisis, but also what will help you feel like you can future plan a little more. The amount is variable, so based on whatever that conversation produces, we had some young people need as little as $200 to resolve their housing instability, and others who needed a few $1,000s. And so this program can be really responsive to what folks need. The payment is unconditional, so they do not need to participate in services beyond that initial housing conversation to receive their payment. And there are no restrictions on how they use their funds. We obviously, through the housing conversation, expect and see that many of them do use it for housing and other basic needs, but there's no conditions put on the payment. With the services that are available, we do set up trainings with our local community-based organizations where we are sharing and setting up services that young people want to utilize. So our hope is, and we're seeing a pretty high uptake of services. And I think that's because they are providing services that resonate with young people. But ultimately, the young people can decide not to participate in services. And it's also meant to be immediate. So obviously these are usually emergent situations. So where we want to be really highly responsive to whatever housing crisis is coming up. And so we ask that our local partners are able to produce the payments in 24 to 48 hours. And just to pop over to the supportive services, so it's 3 to 6 months of optional support services, and that includes housing navigation. So how can we stabilize your relationship with the person that you're staying with your chosen family, friends? How can we mediate with your landlord if you're retaining your housing? Financial empowerment, we have thinking about what is budget, long-term budget look like, what some young people that we're working with are banking for the first time, what does that look like? Having case management. I know for some of our local orgs, the case management term hasn't resonated as much. And so they've been thinking about coaching and skill building as another way to think about that. So really providing thought partnership to the young person about what's the next step, what's the path that they're going forward with. And like Kim said, feel free to interrupt me if you have immediate questions, pop things in the chat. Yeah, just there is a pause at the end, but feel free to interrupt or ask questions too during the session. So I think it's always helpful to see what folks are ending up, what situations communities are seeing. So in Austin, there was this young mother who'd been evicted from her apartment because her husband had lost his job. And so she came to the organization in Austin, and through that housing conversation, her husband had a new job, and so she saw the stability ahead, but needed the bridge to get into the new apartment, feed her family, get furniture inside. And so we were able to provide that bridge into their new place. And then further secure the family's resources through getting her into a GED class, getting her enrolled in SSI, SSDI, and getting the family just more like holistically connected to the community. And in Tucson, one of our local folks there was in school, and she was about to, as classes were ending, she was losing her stable housing of the last 4 years, and she wasn't able to find a job immediately. And so she found this paid internship, but she wouldn't receive her first paycheck until it was too late. And so this program helped her stay in the same apartment that she'd been in, but shift into a more affordable unit, help her with some forward budgeting, and also think about like during that month before her first paycheck was going to come in, what kind of resources would she need to bridge that month as well. So you can see that there's like a breadth of different kind of life situations that we saw across our project, from families to individuals at different stages in life, but that they all were able to utilize this resource to stabilize their housing. So something I'm really excited about, and I'll put in the chat. So we, earlier this week, actually. So it is very hot off the presses. For the 7 communities, we have been partnered with Johns Hopkins University to study the outcomes of the pilot in those 7 communities. And so we've published our 30-day data. So it's 1 month data. And then over the course of this summer, we'll have very quickly 3 and 6 month data. So we're excited to share what we learned at 1 month. So the average cash per household is $3,700. And that is serving 345 total youth households of 623 people. And I always put a star next to that statistic because it feels really meaningful to me that 345 young people were resourced with a cash payment, but it affected 623 people. So we see that when one person is resourced, it has a reverberation, a ripple effect in their community, and they're able to stabilize other people in their households children, parents, partners, friends. So we see it was almost like a 1-to-2, one payment almost stabilized another person with every payment. Um, with the housing statistics, we see the housing outcomes, 90% remain stably housed at 1 month. We had some folks ask us, well, why talk about the 1 month data already? Besides the fact that I think our field very suffers from a lack of data and talking about what we're doing. It was really exciting for us to share something about what we were doing. And I think too, for a prevention project, that first month is actually really important because it's a test of, is that what we're stabilizing, is it actually going to remain stable? Is it going to, could we actually retain that housing, retain that living situation? And so I see that 90% of young people were still stably housed at 1 month. And our metric is coming from interviews and surveys with everyone. And so it's self-reported stable housing. And so that was another iteration from what they do in Washington. So in Washington, their statistic is coming from whether that young person showed up in the homeless management information system, or the system that tracks people experiencing homelessness in communities. It's a HUD and FISB system. And so it's like, unless you show up in that system, you'll be tagged as stably housed by HPDF, where ours is directly from that person, whether they feel stably housed. So that was really meaningful to us. And I have another slide about how the funds are used, but a majority, over half, were used for housing, relocation, and utilities. So we do see that folks are really using it to retain their housing, to continue to pay for their housing. We're also really proud of the demographics that we see through the pilot. We know that BIPOC and queer young people experience homelessness at much higher rates, at disproportionate rates. And they also usually have the secondary impact of having a hard time accessing housing and services in communities. And so to see that 83% of our youth served identified as BIPOC, 40% identified as LGBTQIA+, really means something to us. I think it means we see that community care model really resonates, that we hope that local CBO, that's the center of the wheel, is a safe place for those young people, but also having those partners that are an entry point, and it doesn't matter kind of where your safe place is, because it can be connected to our program. And we also see the other things in folks' life. So 30% had some sort of disability, 27% were pregnant or living with their children. And so having those things also have a chance at stabilization was really important as well. So if you look at the link I put in the chat, that's the landing page for the report. And it has a ton of summary data. It has the longer report. It has some summary findings for each community. It has the videos. It has a ton of stuff. It's really amazing. So to give you some additional findings from the report, so about 50% of clients at that 1 month spot where we checked in with them, they were living in their own place. And then another 23% were staying with bio or chosen family, and 15% were staying or living with friends or roommates. So, you can see the variation of where folks were living. I think in rural communities, I would expect a higher number staying with family or friends, perhaps, or living with roommates. And so totally acknowledging that many of our pilot communities were urban sites or suburban sites. And so that is something in our next cohort of communities we would love to think about. How does this shift, or what does this look like in a rural community? Again, looking at the budget categories, so that 52% was the one I just talked about, but you can see as you click up of the different other budget spending categories that it's all mostly basic needs. There's transportation costs, groceries, debt payment, cell phone. Um, there is not a lot that is not going to just the cost of living in this world. And I am really proud of the 3% that was spent on joy. That was an intentional category to track for us. We wanted to, it was the first time for us that we were making an intentional decision to track how folks were spending their funds as a response to some policymakers and things like that that want to know how young people are spending their money. But we wanted to be able to talk about what access to joy, to self-care, do young people have? And so just seeing, like, one young person was talking about their joy was art supplies for to be able to use to, unwind and create, really affected and improved their mental health, and that really mattered. So we were really happy to see that percentage spent on joy. Um, so to close with just some reflections from the work, we feel like ever more committed to the fact that we believe homelessness prevention is achievable. I think for this, we have a housing crisis in our country, a housing production crisis in our country, affordability crisis in our country, and feel really called to prevent those effects that come with experiencing homelessness. And so wanting to further connections to people in their community and to be able to retain those ties that folks have, that social capital that folks have to retain their housing. And if this resourcing can be one of those things in someone's toolbox, we think that that this is a pathway for homelessness prevention achievement. Continuing on that thought, there are a lot of important downstream benefits of preventing homelessness among young people, just beyond the immediate fact that they do not experience homelessness. We see that when children experience homelessness, that they are more likely to experience homelessness as a young adult and are more likely to experience homelessness as an older adult. And so if we can disrupt those cycles early, and whenever we see them, that we might, if we prevent youth homelessness, we are ultimately preventing older adult homelessness. And that is obviously very important. And then the last reflection, we've just gotten closer to our commitment to trusting young people and what they say they need, and having tailored plans. So to be responsive and to not always be jamming the round peg in the square hole, but really have resources that can be responsive to folks and really trust what they need. So I'll pause. I had some kind of prompting discussion questions just around what gaps currently exist in your communities. Could you see this program meeting those needs? What challenges or opportunities do you see? And really anything else that was coming up in your reflection. So I'll stop sharing so we can see each other's faces, and y'all can take the conversation where we go.
I think one of the things that's coming up for me is around, how others in different support systems can be aware and connect in. I recently attended a rural health, mental health for youth component and was pretty impressed actually with some of the different resources that were available and the different connections. But it seemed like there were still some barriers to cross-departmental opportunities, and maybe I think while there would be folks who would be very supportive and understand the need and the importance of something like this, they're disconnected at present time. So anything you could share about, cross-system communication and supports would be helpful.
Yeah, it's a great point. In my previous role, I did youth homelessness demonstration program TA for HUD. And so yeah, for like 10 years, it was it was wonderful. But there was so much of what you're talking about, Rebecca, just like building those connections. And there were so many meetings where folks after the biggest reflection that folks would say after the meeting was, I know that you exist now, and I didn't know that this resource existed, and I didn't know I could access it. And so I do think that this project and this program opens up those opportunities to communicate more and to share more resources. And so even if we saw in some of our communities that even if that young person didn't ultimately end up receiving the cash resource, that they received like all these other mainstream supportive services, that they felt maybe not equally secure, but still had something shift during that meeting. And so, yeah, do you think in the beginning, laying the groundwork with community before the project is even rolled out, that really the learning about that and learning like who's in the room, who should we be targeting for this prevention training, making a list, who knows someone here, who do we need to get a warmer relationship with, that's a huge component of the first part. And it's a great question.
Michelle, jump in. You've got your hand up.
Thank you. I apologize. I do not have my camera on. I'm experiencing some technical difficulties. I am wondering because our organization has really wanted to get involved in direct cash transfers for quite some time now. Um, except for we have not figured out like how does this program get funded? Like where like who is and in rural communities like ours, we don't have a large donor base. We are really relying on grants. We are like 95% grant funded. So just curious what yeah, how do we essentially get support to be able to find the funding for a program
Yeah.
like this and make it sustainable within our communities?
Yeah, that wasn't at all a popular question on people's faces or in the chat. And I was actually, as I was sitting with my slides, like 15 minutes before we started, Kim, I was like, oh, I didn't put in a funding slide. I'm sure that will come up, so I don't have to worry too much about it. So at PSY, I'm the person that does our fundraising for this program. And so um, across our programs, it's a mix of state funding, private philanthropy. Um, at one point, there was federal funding for this. I don't know if any of your communities are the Prevention Demonstration Program communities from FISB. So also there. And so that, was federal funding. We had a very exciting policy framework for a Harris administration. So I think, at this time, like 6 months ago or so, I guess, gosh, it's been even longer now, 7 months ago, we were thinking, oh, the tide is turning for federal support around flexible cash. But I think we are also this moment in time, I will affirm and not tell you all that this is like, of course, it's so easy to fundraise right now. Not only are we losing support from the federal budget, but Michelle, I think you're in Washington, where I know there's a $15 billion state deficit. And so I recognize that the federal funding landscape is affecting the state funding landscape, and that many of you are sitting looking at your existing programs. And so how do we support our existing programs? How do we ramp up a new program when our existing programs are having a difficult time? And so we have, I would say for myself, I see in the philanthropy world that, and I know a lot of philanthropy is place-based, but there are some national philanthropy partners that are starting to think about it in a more expansive way. I've also been trying to meet with some national rural philanthropy to try to get them thinking about this more, how to unlock their resources, and think about their communities in a way that doesn't have as many parameters. But I would say I see Madison that in Maine the state funding is also murky, but I do know in some, like in Michigan, their state budget is not as murky as Washington's or maybe Maine's, but they're thinking about supporting cash in their next state budget. So I think in some ways too, this is a lot of laying the seeds, planting the seeds, and thinking about how does socialization look like now, that I can start talking about this project with my policy folks, like getting really, I'm sure many of you are familiar with how money flows through your states. So how do we get money? Is it a legislative ask? Is it a department ask? Is it getting to the governor for them to put a budget ask in? And so working on the many ways that you get money in your state. In Austin, which is a blueberry in a strawberry pie, they were able to secure local city funding for the next phase of their pilot. And so I will acknowledge that philanthropy is also too like your more innovative partner, like they are willing to be at the front. We've had some in Grand Rapids. They held a convening for all of their any local connections that they had. So they invited their individual donors, they invited their corporate, they invited like anyone who is giving to the organization to talk about the project. And they had more excitement than they were even expecting, and also from not just I don't know if y'all remember Betsy DeVos from Trump's first administration, the Secretary of Education. Her family has a foundation in Grand Rapids, and they're interested in being a part of the next round. I think so when we think about economic autonomy and prosperity, that message has resonated with more conservative funders. And so, yeah, I think just my advice is it's a marathon, not a sprint, and starting to think about like, what do you know about your local funding base and what might be ways that this can connect and resonate with them, and starting to talk locally in your community about what are the meaningful things in our community and how do we talk about them with funders, and starting to put the things together. And also thinking about, sorry, this is a very long-winded answer, like what are the other ways that your system is paying for young people regardless? Like we've had in LA, their hospital system is supporting this pilot as a part of their foundation giving, because they see when young people experience homelessness, they become higher utilizer of our emergency room system. And we would rather push resources not to increased services at our emergency room, but into housing. And so I think too, thinking about the other systems that your projects interact with as well. We'll take pushback, thoughts, all the things.
Lauren, I have a question for you off of that, which is that we know some of the people on this call, and some of you are sitting in, we all are working with rural, but some of you are sitting in very small communities, right? So just in terms of like the pressures we feel in rural around scale, So it would be helpful if you have any examples of how this can work on a, like, is there a baseline dollar amount? Are there examples of programs that are serving much smaller numbers of young people, yet the impact, as we know, I know I don't need to make the case to you for impact, that's why we're having this, right? But just helping just folks think about that for a few minutes, right? Where systems are limited, communities are small. I know we have some folks on here that are sitting in communities certainly under 2,000 people and maybe under 1,000 folks, right? So just sort of in serving a larger area, right? Like serving a county or a whole region of the state, if that made sense.
Yeah, absolutely. The first thing that came to my mind when you started talking was one of our first pilots was with Burlington, Vermont, which is not less than 2,000 people, but still a small city. And their first pilot was 10 young people. And they had an individual donor that came to them and said, I've heard about this thing. I think y'all should do it. I want to give you, I forget what the number was, $100,000 to do it. I want it. And they came to us and said, we have no idea how to do this quickly. And so we kind of helped them map out what does it look like to do this with 10 young people. And so they pulled a little time from this staff person. They came up with an amount that they thought per young person. And then they have a social enterprise within their organization. So they were thinking about like, what are the other services we have in our org? But then they got going on 10. And they worked with the University, a social work student at the University of Vermont to track some of their outcomes. They were on a Google spreadsheet tracking outcomes, doing some surveys through a Google form. So the resources they already had available within the organization. And when they went back to that donor with their outcomes, the donor said, oh, I would love to do another one. And I would love to talk with you about what does it look like to open the doors in my network, right? When you think about how you think of your board or other folks that are kind of already committed to your community, the time, the treasure, the connections, right? And so someone else that's also a part of your socialization process, that once you have other folks who kind of have your language, have what you're manifesting, what your goal is, then they can also be talking in their network. But that's also my favorite thing about this project is it can start with a cohort of 10, with a cohort of 5, and then it can scale as you start to kind of figure out the secret sauce of your individual project, and then it can scale to your county, your state, thinking about it. It really does turn the dial up much easier than I think other projects that require like a rapid rehousing project. Well, now we have to find these apartments, we have to find landlords, we have to find leases. So I think that there's a lot of power in this program of starting. So you can start small and kind of make the numbers work on starting small. No, Kim, you're on mute.
I'm the host and I'm supposed to know to unmute myself. So, one last question dropped into chat. Madison, you're sharing that you're thinking about this work. This is a great point. Thinking about this work in the context of youth who have caused harm. Many of the youth we work with have been through the criminal legal system, justice involved, and funders often become hesitant to support this population. Absolutely. I'm curious, do you have any stats connected to this population and reductions in recidivism?
It's a great point that you're bringing up, Madison, and we have stats from Entry where we see, I think it was about a third of young people had had experience with another system prior to their enrollment in the project, and so that includes the criminal justice system, that includes foster care. And so that's something that we're tracking in our longer longitudinal research where we can show, hey, actually, housing reduces recidivism, stabilizes folks, allows them access to the next stage of their life. And also thinking about just going back to that, like, funding and seeding is when we have reductions in that recidivism, that's also this is all a policy choice, right? Like, we have the resources, it's just how we're spending them in our communities. And so how can we think about shifts in how we spend our money to direct them back to young people, back to populations who have been harmed by systems, rather than continuing to invest in systems that harm them?
Any last questions, comments, thoughts?
Yeah, Michelle, love that. Kim, for the conversation in June, if folks want, as this conversation's percolating, if there are things that folks are coming up that they want to send for you, that I can kind of
Right.
come a little more prepared for June, that would be great.
Yeah, we'll absolutely do that. So we will work to get the recording turned around to you pretty quickly so that it goes out. We also have a bunch of folks that were signed up, wanted the recording, and may be joining for the June session. So we may see some new faces on there too. Huge thank you, Lauren, for joining us. Huge thank you to everyone taking time to join, all your great questions. Just a reminder, the follow-up session, your interest is piqued, you want to explore this further, is on June 5th, 2 p.m. Eastern Time. Again, we'll send out the reminder and the link again if you need it. And as we always like to say, a huge thank you to you all for the work that you do, wearing all the different hats that you wear, and for all the love that you shower on all our young people. So again, I'm Kim Finney, Royal Youth Catalyst, and my colleague is Kathleen Moxon, and we've had the huge privilege of having Lauren Wilkie with us today. Thank you, everyone. And once again, a final shout out to Chloe Seaton, who is our magical wizard of Zoom and all the secret things that neither Kathy or I know how to do very well. But you all know exactly that kind of wizardry. Wishing you 3% at least of joy in your day, if not higher. And have a great afternoon. And thank you all so very much.
Yeah, thank y'all. Thanks, Kim. Thanks, Kathy.
Thanks.